Hi everyone, this is Dr. Jolynne Cupido, and this is Something to Somebody documentary series shot by Word Over Flesh Production. I'm Dr. Jolynne Cupido. Matlo is my married surname, so I'm practicing under my maiden name. I opened my own practice in 2019. I'm basically giving general dental services to the community, to the public, right in the location. The reason why it's in the location is because I want to give access, dental access to everyone, and make it affordable, not only, as affordable as possible, and also just to make sure that everyone gets comprehensive dental services. So firstly, I did my community service here in Bethlehem. So the place was very close to my heart. And then I moved away because there was no job opportunities. I worked for someone in Bloemfontein for about 8 months. And I just realized that I really don't want to work for someone else. And I would love to come back to Bethlehem, but there was also no job opportunities. So I started my own. I came back. It was rough. It was tough at the beginning, but then I just had to make it work. And I started with like very little. Like I didn't have everything, but I started with what I had. Yes, I started only with like the basics, the chair, the compressor, like certain things. I didn't have any staff, but it was just me. I was the receptionist, I was the dental assistant, I was the dentist, I was all rounder for quite a while. And I didn't have the X-ray machine, but after a few months, I could buy the X-ray machine. So yeah, I had to sell my car to buy the X-ray machine and to grow the business. And yeah, it happened, and I'm not having any regrets because now it's working for me. So I would say my practice is quite laid back, friendly, family practice. So everyone is welcome. And I strive to give people their smiles back, even if it's not it's not that expensive as other practices. I think the affordability separates it from other practices, that it's quite affordable, but then it still gives people access. So yeah, that's what I'm striving to do, is to help more people, to give more people smiles back. Yes. People don't have to go all the way, take transport and all of that. So all those things were being considered. Yeah, I started alone, but it wasn't like I wasn't all on my own. Like my mom was like a great support, like my brother, my husband, who was my fiance then, my friends, colleagues, everyone. They were all like part of this business, like beginning. So I didn't even, I made up my mind. I was like, I'm starting this business. I'm leaving Bloom. I'm coming back to Bethlehem and I'm starting this business. I used everything, all the savings, everything. In the beginning, like the business was not making money. I was looking at what the first month it made like so little money and the expenses were up there. But then I just came every day. I just came. I came 8 o'clock. I left 7 o'clock. Nothing, zero patients, whole week, no patients. But then, like every day, I just came and showed up, and later on, the patients started coming, and now like my patients are my family. Like I'm getting so used to them, and like it's so nice building relationships. Word of mouth goes out there, and then they tell their families, their friends, and like the business really grew. Oh yeah, so I was saying like debit orders, like we had our debts, and debit orders they don't ask like, do you have enough money? Like they just went off. So we had to dig into our savings and just put it all in there, because at the end of the day you want this thing to work, and it's all about the passion. Just coming and showing up every day. Yeah, and I had a lot of support from all the people that I've just mentioned also. I think it's my passion for people, um, for wanting to help, and like I love what I'm doing. Like, there's a saying of Confucius that says, "If you love what you're doing, you won't work a day in your life." And I'm not working; I'm having fun. Mostly, I work on appointment basis. It's just easier to make appointments for clients, and then also my receptionist. She's killing it. Yeah, so um, my assistant, both of them, really, I'm so grateful for them. They're doing most of the work. I literally just have to come, and then everything is sorted. So yeah. I had walk-ins, but then I would say I would separate, like I would put time aside. So I had to be the receptionist, so I would call in the morning, like call the patients for their follow-ups, and then when they come, I give an hour appointment, because I have to see them an hour or 2 hours depending on what needs to be done. I would see them. After that, instruments, they need to be cleaned and sterilized, so I would sterilize and do everything around that. So I would literally work out my day and diarize everything, write everything down, so that nothing clashes, because some days can be rough, some days can be hectic, but then like you just have to push through it. I didn't. Like financially,
Slightly.
things were tough, but then, like as I said, I had to take my savings and push it in, like everything. It was difficult.
It doesn't sound difficult. I don't know, but then, yeah, you're not selling it enough.
I'm not telling it.
Yeah. But then I get it. It's
Yeah.
favor.
I wouldn't say clinical, more on the business side. Okay, the advantages are like we get days off. We can manage our time. Um, you can get your days off. You don't have to apply for leave, all those things. But if you don't work, you don't pay. You don't get paid. So if you're not here, like you're running the business, like you're running things, you need to be here. Then there's nothing coming in, and then yeah. Sometimes a lot of people say like dentists, they don't take their work home. We do. We do. Sometimes you think about patients, like people going through a lot of things. Like the past few months I've been battling with one of these clients. She had a lesion in her mouth, and I was quite worried about it. We did biopsies and everything, it never went away. And yesterday she came in and she just healed. Like it's so satisfying. Like the job satisfaction is great, but then yeah, on the business side, it's sometimes you have to put in everything, and you never rest as a business person. You're always thinking. You're on holiday, you're thinking what's gonna happen next, who's gonna be your next patient, like what are you gonna do next, how can you grow as a business. Every night we dream teeth. I think when you have patients scheduled, say for certain times, and then you're running overtime, then the next patient is gonna be seen a little bit later. Like it's just like a domino effect, and then everything is crazy. It feels like everything is just going haywire, and then sometimes we are not the people's favorite people to see. Like the first thing when they see you, they tell you, I don't like a dentist. Like imagine coming every day and people tell you that. You must have passion for it. So yeah, on a day like that, if someone tells you that our feelings get hurt, but then like you have to pick it up and just come back tomorrow with a fresh attitude. Don't take anything personal. And yeah, people are normally in pain, so they say things. I would say make up your mind, because in the beginning I wasn't sure should I or shouldn't I. Make up your mind and go for it, and get a business plan, because I didn't get a business plan. I just used whatever I could, and then later on I got stuck a bit. But then get a business plan, write it up, do it, and then go look for funding. It just makes life, I think it should make life much easier. And then just show up, just be there for yourself at first, because in the beginning you're not going to have everyone supporting you, and people are going to think sometimes you are not okay. If you when you start out, but then little by little it will grow. If you believe in yourself and you show up for yourself, it will definitely grow. So yeah, just put in the work. Milestones, like I see, like even the small things like they mean a lot to me. Like when I bought the x-ray machine, when I got like furniture, like small things. And then later on, when I started to, like, I can donate now. In the beginning you couldn't. Like, you can donate now monthly. You're giving something, like you're giving back. And I'm doing pro bono cases for braces for people who can't afford it. So really, like, it's really been a blessing being in this business and being a blessing to others. It's even more satisfying. Definitely, it can't be. It can't be just be anything. It can't be anything else. It's from God. It's that gift of kindness. Um, it just like you. I feel like that you must like whatever God blesses you with, you're supposed to bless other people. You can't just keep it to yourself. Like that light, like everyone needs to know. Yeah. Industry changes. Like I keep on educating myself. Like the continuous education. I'm always busy with that. And then the social media thing, I'm trying. I'm really trying, but I'm not that good. But I'm trying. Yeah. I would like to expand. Um, I would like to expand, and I would like to have a mobile clinic where you can go to, like, remote areas, those places where no one goes, where there's no shops in the towns, like those places. Because I'm coming from a small place myself, and we don't have a dentist where I am coming from. So yeah, I would love to do that one day, and I would really love to partner with my friends in the industry and make this thing work, because we've been talking about it. So I would really love to see it materialize very soon. I was think grade 6, grade 7, very crooked teeth. And we don't have a dentist in town. So my mom had to take me every month to the next town or two towns, because the doctor would then be here, then be there, um, to go fix my teeth, get braces done, and that's where it started. That's where the passion started, because like he fixed my smile and I was like, I want to do that for other people, like because I used to be mocked um, for the crooked teeth, and then everything just changed. And yeah, I was really granted like great privileges in my life, like high school, I moved away from home, varsity, like even now. So I would really love to get to that point where I get a mobile clinic and get back and give back to my own community. I really enjoy it where I'm situated at the moment. This is home now. But I really just wish I can go back. But I think I wouldn't be able to live at home again. That's why I would love to have something mobile so that I can give back but not be stationed there. I think it would have a really great impact, because whenever I go home, people see me in the street and they're like, "Oh, you must pull my tooth." You know what? I wish I could. Like, I really wish I could, but then like there's no way I can, because there's no. There are facilities. There are dentists that go there now every once in a month or so, but there's no dentist. In the government, there's limited resources. So most of the time they just extract people's teeth. And you know, my thing is, I want to give you back your smile. Sometimes if you are working in the government, you see, no, I can fix this tooth, and then you have to extract it because that's all you have. That's all you have access to. And then, so I feel like we can really, really make a difference if that dream realizes. I said earlier that we sometimes take our work home. So you think, but then I'm married, so I have my husband at home. And so when we get home, we don't talk. You don't talk patience. You don't talk, like, sometimes you need to stress relief and just tell you about my day, but then we keep it to a minimum so that it doesn't overwhelm, like, so that we keep the balance between work and life. And then other than that, my friends, home cell, church, like, we make time for it. You need to make time for things that are important. I think making time, like, for all of those things. You need to make time for family. You need to make time for your friends. You need to make time for church, for work, and everything. So don't take your work home. I would say it's possible, but to avoid burnout, it's not advisable. Yes, because there's so many, like, you can create jobs, firstly, helping people, and then also you are not overloaded with all of the work. You can delegate the work. It's your dental chair. It can't work without the compressor. I think you guys heard the compressor in the cupboard earlier. It powers the chair.
Oh.
Yeah, and then autoclave right over there, to sterilize the instruments, like under high temperature, pressure and steam, so that everything is clean for each and every patient. And then your x-ray machines to help you diagnose cavities or whatever you're looking for. It really helps in the diagnostic process. And then in the near future, a sensor for the x-ray machine, because we're still doing like hand developing the x-rays. So hopefully a sensor so that everything can be like viewed electronically. It's difficult to say what type of pain. Like you get different types of pain.
Short, sharp pain.
Yes, short, sharp pain. Yes, those are your sensitivities. So if they have pain, go visit your dentist. Like we can tell by looking, by feeling, by taking x-rays, seeing how far the lesion has progressed, and then take it from there. Okay, there's not much that can help, but like if it's in the middle of the night and your dentist can't see you that time, clove oil or cloves, put it on there. No Disprin, please, no grandpa. It eats away at your mucosa, like the skin on the inside of your mouth. So yeah, and it also makes the blood quite thin. So if the tooth needs to be extracted, it's gonna have to be delayed, because now your blood is thin. Because of the Disprin and the grandpa, the blood thinners, and then it can make you like have prolonged bleeding. So it's not advisable to do that. Clove oil or cloves. Or you can take anti-inflammatory pills, maybe a Brufen or something, but it depends. You shouldn't have asthma, you shouldn't have stomach ulcers. It depends on your medical conditions also. And then, or Panado for safety. Yeah. Yeah. It depends from patient to patient. It depends what the problem is. I would say to all my patients, a fluoridated toothpaste, like anything that has fluoride for your day-to-day cleaning. But then if you have problems like gum problems, you get your Colgate Total 12, you get your Parodontax from GSK, then sensitive teeth, Pronamel, Sensodyne Repair Protect. It depends. If you have like little enamel gone, you can use your Pronamel. If it's a bit more damaged, then you can use your Repair and Protect. So it depends, it really depends. Or you can use Almex. There is a whole lot on the market. Meridol also for gum problems. Sensodyne works. Also, I would say their reps are very proactive. That's why you see Sensodyne everywhere, but it's the #1 recommended brand by dentists. Because a lot of patients come back, we ask, we give you, and then we ask, how is it going? How is this treating you? We give you different ones. And then we see actually which ones work and which ones don't. Because now you'll be in my chair and you'll jump because I'm blowing a little bit of air. And then next time I give you that, and then you come back, blow air, and it's better. So that day-to-day toothpaste, it does make a difference. Everything doesn't work for everyone, but then like whatever suits your needs. I don't think so. I don't think so. As long as it like meets the needs, it meets your needs. Smoking, #1. Smoking is bad for your teeth. It causes a lot of stains. It causes like nicotinic stomatitis, like little holes in the palate. Can cause cancer, so it's really not good. Then sweets, you can eat sweets. I'm not saying you can't eat sweets, but then the longer the sweet stays in your mouth and you don't clean it or you don't rinse with water, then the bacteria, we all have bacteria in our mouths, it feeds on that sugar in the mouth, and then it releases acid. And we all know what happens when acid comes into contact with something, it creates a hole. So that's how your cavity starts. Because I feel like we're always warm, we're always busy, always doing something, wearing a lot of clothes, and you have to hold down a 2-year-old. It gets tiring, like it gets hot. And I feel like scrubs are more comfortable and more friendly. I'm not a fan of the white coat. Yeah, it scares kids and it scares people in general. Everyone that contributed to this business, my mother, my husband, my brother, my family, my friends, all the dental ones, all the non-dental ones, yeah, colleagues, like I've been bothering them ever since asking questions. Yeah, everyone, my staff, like, yeah, my staff, and then the people that I work with, Dr. Matthew and his wife, and then lastly, but most importantly, the patients. Like, they are the reason for all of this. Yeah.
Gotta stay 10 toes from my hood, yeah, I'll never switch.
I'm at the peak of all my energies. Keep it cooler underwater. Keep on feeling pressure, but I know pressure make a diamond. Never panic, no. It's my time to shine. Never fumble, hold my grip, oh yeah. I've been there, done that. 10 toes, fully in. Switch lanes, I did that. Did no more running back. I trust in God until I go off. Hey, I trust in God until I go off. Oh yeah. Oh yeah.